Right.
We are live now.
Good evening and welcome to this webinar, which has been organized by Meradoc. Thank you very much, Meradoc, for organizing this and having gotten two stalwarts of India together to reflect on what is happening with the present COVID wave, with the previous one, what the future holds for us. And let me introduce the two guests. Dr. Arvind Lal, who is one of the foremost practitioners, diagnosticians that we have in the country. He's, of course, the chairman of Dr. Lal PathLabs, a pathologist by profession, and also a humanist to the core. He is a recipient of the Padma Shri. He graduated and did his post-graduation from the Armed Forces Medical College, where in the initial years he was also the hostel warden. And I'm told that many of the junior batches remember him very, very fondly. He is also, a book has been written on him called, the Corporate Yogi, and that is what he is. He is very much into spirituality and also has an ashram of which he's the head. So you can see how many caps he wears, and needless to say, we are proud as doctors that apart from all the other great qualities that he has, he's also a dollar billionaire. And if I say the only one that this country has produced, I'm not exaggerating. So welcome, Dr. Lal, and we look forward to getting your insights into this pandemic and what the future holds for us, both as regards COVID-19 and these so many other diseases that we face on a day-to-day basis. On the other side, we have one of the finest bureaucrats that this country has produced in the recent past, Mr. C.K. Mishra, who graduated from the famous St. Stephen's College, where I'm told he was also the college president. And I'm told that he had great organizational capacities even at that time, and also was adept at dramatics, the arts, and so on and so forth. Having come from Bihar, he adapted very quickly to the environs of Delhi, and right after his graduation, being a brilliant student, he joined the Indian Administrative Service and is of the 1983 batch. He has contributed a lot to the development of healthcare, not only within the entire country as a whole, as the Secretary of the Health and Welfare and Family Welfare Ministry, but also in Bihar, which cadre he belongs to, where he worked and tried his level best to bring things up to the mark. He spent quite a few years in the Ministry of Health at the center, first as Additional Secretary of Health, where he was responsible for the Rural Health Mission, for the vaccination program, which this country has conducted very, very successfully over the last few decades. Also responsible for the new health policy, which was rolled out during his tenure as Secretary Health. After that, he actually shifted to another very important ministry, which also has some impact on the health of citizens, which is environment and forests. And after having acquitted himself very well in that ministry, is now a free bird, as he says, and is helping many of the private entrepreneurs and others as an advisor, advising them on how to go about bringing better more focused healthcare at affordable rates, and also how to provide accessibility to the rural parts of the world of our country. So welcome, Mr. Mishra, welcome, Dr. Arvind Lal. And may I start with you, Dr. Lal? Being a doctor, I think in this program from Mera Doc, we can give you that privilege and that head start. So now history has shown that the burden of health calamities on developing countries is always disproportionate. You know, we end up, the poorer countries, the developing countries, end up bearing the brunt of any calamity. What do you think about India's COVID response, both in the first wave and the second wave? And then we'll come to Mr. Mishra, who actually spearheaded the task force which was responsible for the initial wave one response. So, Dr. Lal, please.
Thank you very much, Harsh, and thank you, for organizing this seminar. And it's great to see Mr. Mishra again. But ladies and gentlemen, before we start the session, I would first like to salute all the COVID warriors, especially our more than 1,500 doctor colleagues who have valiantly laid down their lives to fight this wretched pandemic. So I think let me go into a little bit of the perspective of COVID. And this is a new avatar of COVID because the earlier one was from 1918 to 1919, 2 years, a Spanish flu, which means it has come after about 101 years. And at that time also, it had infected many more people than now. It infected, in fact, about 50 crore people at that time, which was 1/3 of the world's population then. And it killed an estimated 5 crore people, which was more than the people dying in the First World War. In India, of course, it was brought in by our soldiers who were returning back from the European theater of war, and it was known as the Bombay fever, and it killed 1.5 crore people. The famous 20th century poet, Nirala, wrote a poem by the name of A Life Misspent, in which he mentioned that our holy river Gangaji was swollen with dead bodies and there was not enough wood to cremate the bodies. 1.5 crore people died when the population of India was only 30 crores, which is 5% of the people. And currently for COVID-19, 3 crore people have been infected and reported deaths in India are just over 4 lakhs. And had there been 5% deaths, which took place in 1918 and 1919, the count would have been 7 crore deaths. So God has been kind in spite of whatever we have seen and whatever we're going to discuss now. The global figures, of course, are 18.5 crore people infected and about 40 lakh have died. Now, Harsh, talking about the second wave, I am reminded of what used to be said in cricket during our test match days, when the radio commentators like Dr. Puri, I hope he's watching this, and Maharaj Kumar Vizi of Vizianagaram used to comment that India is in the habit of snatching defeat from the jaws of victory. COVID exposed the harsh realities of Indian healthcare and global media. India mounted a very strong response with multi-pronged efforts to contain the infection. And in the first wave, that included a very strict lockdown, test, track, isolate, and treat strategy, strong messaging on basic preventive measures like use of masks and frequent hand washing. And India had the second largest number of cases and third largest number of deaths in the world. So we managed the first wave well, but after that, a false sense of normalcy crept in. We declared victory too soon and completely forgot history's lessons and doctors' advice about the impending second wave. So the first wave basically peaked with less than 1 lakh daily cases, whereas the second wave had more than 4 lakh daily cases at the peak. And in the whole year, the deaths in the first wave were about 1.5 lakhs, whereas in 2021, from January onwards, 2.5 lakh people have already died. And of course, I mentioned about the doctors. But let me tell you, in the first 9 months, that is in 2020, 748 of our brethren had died. And since 2021, January onwards till June, 776 have died. So I would like to also add that in January this year, when the infections went down to about 20,000 per day, it is that time when we declared, a premature victory. And our greatest mistake was in completely unlocking to revive the economy, completely forgetting that lives matter more than livelihoods. Masses gathered for political rallies and religious events, and people became complacent, and so-called pandemic fatigue also set in. The second wave was magnified due to the fact that we got the imported alpha strain from Britain, and not to be left behind, we came out with our own delta strain, which was up to 5 times more infective and at least 2.5 times more fatal. Now you all talk about CT values. This has a CT value of 16.5, whereas the original Wuhan virus strain had of 19. And to top it all, we also have the new avatar, the Delta Plus, which is already recorded 80 cases reported in the country so far, and the Lambda virus has already been talked about. Thank you.
So, thank you very much for putting things in context, telling us about the difference between the first and the second wave, the variants of concern that were new, and where, as a people, we may have faltered, having declared victory maybe too soon. If I may take that to Mr. Mishra, you were involved with the initial, response to the pandemic in the beginning, March 2020, April, May. That's when the country was in lockdown. What prompted the lockdown? Since you were very much present there, how do you think we did during that period? And do you think if the lockdown had been shorter or had not happened, would things have been different? And how do you think we confronted the second wave when actually you were looking at it from outside as a bystander?
Thank you, Dr. Mahajan, and thank you for that wonderful introduction. I don't know how much of it does it deserve, but thank you very much. But before I get into what you just asked me about the preparation during the first, you asked a question that how does it disproportionately affect developing countries?
Yes.
Any calamity, let alone medical calamity, health emergency, does impact developing countries more than any others. And the tragedy gets worse because it impacts the underprivileged in those countries the maximum. Therefore, the challenge lies in getting all your resources together, all your ability together to reach that underprivileged. And this is a huge challenge. Very few countries have the resources to meet that. And when we talk about pandemics, let us keep this in mind that our reach is not great today in India as we want it to be or as it should be. Therefore, the most impacted will continue to be the underprivileged. Now, coming to your question about the first wave, it's very often a mystery to me. When the first wave hit India, we were ill-prepared, little prepared, no idea. We seem to have done well. When the second wave hit India, theoretically at least, we were better prepared. We knew more about the virus. We knew about the resources required, about the beds and services that would be required. But somehow other things went wrong and our hospital systems got overwhelmed. So there are many reasons, and Dr. Lal has talked about some of those reasons. There are many reasons why this happened. Perhaps one of the principal reasons is what Dr. Lal said, that we kind of began our celebrations a bit too soon. let me not put the blame entirely on this. Let me also squarely say that it was not just the celebration bit, but also to a great extent, lack of scientific knowledge, lack of, or even where we had knowledge, acknowledging that and accepting that science is the background. If you don't trust science, and if you don't let science occupy the principal place in your planning process, you will have some problems. Yes, very unfortunate that we were caught unprepared, both in terms of the capacity to handle and also in terms of resources like oxygen and other drugs and other things.
Yeah, it is probably because, we saw such an upsurge, that no country in the world probably could have managed it. And we've seen even developed countries going down. But when you talk about science and evidence and data, do you think we were lacking somewhere, or did we pay full attention, and that's why we were caught unawares?
I would say partly yes. Partly yes, because we were not prepared for such a surge. Whereas I'm told that certain predictions had this in place. It was also because some of the lessons of the first wave were not carried through into the second. Dr. Lal was saying that if it was 5%, it would have been so and so. It gives us a false sense of safety. And I think that is precisely what we have to avoid. But let me tell you, more than being critical, we need to be appreciative of the fact that the hospital systems were overwhelmed. They were not in a position to handle this sudden surge. Therefore, the introspection should not be on where we made mistakes. The introspection should be on how do we now build that system not to face this again.
That's very good.
Yeah, you also spoke about the lockdown. That's a critical period. And let me tell all of those who have joined us today. You see, in hindsight, it is very easy to call a decision correct or wrong. A decision is taken on the spur of the moment. And it is not that the lockdown had only the wrong things about it. There were many, many things which the lockdown provided which were positive. So at that point of time, that seemed the best possible solution. But then we learned our lessons that while we were able to prevent the virus from spreading, economic hardships came in abundance. So we did not do it the second time around that way. So you learn from one another. But let me again state that it would be easy to analyze and say that that was a wrong decision. But perhaps at that point of time, this was the decision that should have been taken.
Thank you for putting it like that, because like you said, one is always wiser by hindsight. But personally, I believe that the lockdown was essential, that the lockdown helped us, that the lockdown prepared us, both as far as healthcare facilities, medicine, beds, ventilators, which later we realized we didn't need so many ventilators. But at that point of time, it seemed that was the panacea. And also, if you look at the textile industry, which rose like one, and today we are exporting PPE kits, which not a single was manufactured in this country. So there were a lot of good things that happened because of the lockdown, which gave us time to breathe and learn and, frankly, run. Now, Dr. Lal, if I may take the same question to you, what do you feel? What could have been done better based on scientific knowledge, based on data, which may have, now in hindsight, helped us in being better prepared for this second wave?
So I think that these are all, well, I think let us go, forward on this, and what is the way out? You are asking basically out of this pandemic.
I'm just talking about the learnings, which, we are talking about the third wave.
Yeah.
So something where, we can learn from this and do better the next time.
I think the basic tenets have not changed, and that is test, track, isolate, and vaccinate. And be very, very careful when the people fall sick. You have to be very nimble-footed. You've got to be flexible. You should be able to, set up, your, field hospitals, as we call them, and for large number of people. And there is always a problem of creating so much of infrastructure, and what happens to the infrastructure when the whole thing comes down. But I think what the first wave has told us is that you cannot let your guard off at any time.
So let me ask you a question as a follow-up to that. Do you think the third wave is inevitable? And if it is, which many people say that it is, then how should we be prepared for it?
Well, the experience from the past influenza epidemics all suggest that the current COVID pandemic, it is no different. And the other countries also, their experience suggests that there might be more than two waves, for this infection. And also, please take note that the second wave has still not finished and is still showing a tail instead of a full flattening of curve, as we used to call it. And this inevitably will rise and be known as a third wave. And on the other hand, I must emphasize that the IMA, or Indian Medical Association, has already warned that the third wave is just around the corner. And many state governments and people are again becoming complacent. The Prime Minister has also warned in the headlines, today or yesterday, that the people are not adhering to COVID compliant behavior. And this can be also gauged from what we have seen recently, that 35,000 tourists reached the outskirts of Nainital and 32,000 traveled all the way to Mussoorie in Uttarakhand over just one last weekend. And images of large number of tourists without masks having a dip in the Kempty Falls in Mussoorie is very fresh in people's mind. And as what happened, we also in Delhi, as soon as the curbs were lifted, a single mall in Delhi recorded a footfall of 19,000 people in a few hours. And now that the Uttarakhand government has stopped the Kavar Yatra, or Kavadiya Yatra as we used to call it, the UP government is still stalling. It's allowed it. And the Supreme Court is already after them. In 2019, I must, again reiterate that 3 crore people participated from 10 states in this Kavadiya Yatra, Kanvar Yatra. But we don't want a repeat of the super spreader events like the Kumbh Mela in Haridwar this year, do we? We don't. So India is still struggling to come out of the terrible and tragic second wave. We may not be able to handle the third wave if it arrives at such a short gap. And by the way, in Bombay, they've already, done better than many other people, as you all know. And they are expecting 80 lakh people to be infected. However, it is in our hands to stay away from these religious congregations and wear masks and get ourselves vaccinated quickly. This is a very small price to pay compared to losing innumerable lives and livelihoods. And many international, public health experts and countries like Singapore have already accepted that COVID-19 may never disappear completely and shall reach a stage of coexistence known as an endemic state, like the HIV and HBV and HCV viruses we have to learn to live with. So this is what I would like to say about the so-called third wave. So savdhani hati, durghatna ghati.
And it's all happening in the hills. और ये जो sign है ये hills में ही ज़्यादा दिखता है. So, we have some active participation from our, people who are attending, and some of them say that the first principle should be to tell the truth and to accept the truth, whether something went wrong, whether something went right. And also, one of them says that the fact that the West did not do so well should not be taken as a shield that if they couldn't do it, so how are we expected to do it? And I think these are comments which are very well taken, and they are very, very correct. Now, as an administrator and as someone who's looked after the healthcare of the entire country, what would you do, Mr. Mishra, at this point of time to see that one, the third wave does not come? Two, if it does come, that it's as small as possible, possibly a ripple rather than a wave. What do you feel should be our approach at this point of time on mid-July?
See, your earlier question about the learnings from the first wave is linked to what you just asked. We as a country have consistently, and I'm saying this because that's been the practice, have consistently refused to learn either from our failures or from our successes. We've ignored both. We've forgotten our successes and buried our failures. That is the way we have moved. We need to pay focused attention to what went wrong where and correct it. And perhaps, as you said, the best way to do that is first sit down and acknowledge that there was a mistake. Because corrective action will start only then. Now, as an administrator, one thing that I would like to say is that the system needs to be better organized. There has to be a pre-planned approach between the private sector, the public sector. And it's not just about government. This coordination is not just about government, it's about people. Second, and I think if at all you want to succeed, you must invest in health. Unless you invest in health, the resources will not come about. Merely saying that we need X will not solve the problem. You have to get that X on ground, which means real resources, which means both financial resources, physical resources. Therefore, my argument as an administrator would be that let us increase our input of resources, both from the government kitty and the private sector, in strengthening our system. If you look at the second wave, it was not as if our doctors were less capable. It was not as if we didn't know what to do. The problem was we didn't know where to do it. There were no beds, there was no oxygen. So for a medical person, seeing no help coming, although he knows what is going to happen, is a disastrous position. Therefore, as a country, we must invest in health.
Let me ask you a question on that. Since you brought us to a very, very important part, because somehow, we over the years have not really invested much. What do you think has been the flow and direction of investments in health in India? And will we ever come to, that magic 2.5% of GDP being spent by the government? What are your thoughts on this? And then I'll come to Dr. Lal and ask him the same. And also about public-private partnership and how the two are going hand in hand and if things can be done better.
Before I get into the investment issue, I'd like to take half a minute to answer one of the questions that is there on the chat.
Yes.
When we are talking about developing countries, the conversation is not about the ability of the developing countries. The conversation is about the impact on the developing countries. And these are two completely different things. But anyway, coming back to your investment, to your question of Do we see 2.5 happen or not? I happen to be part of the discussion when I was finalizing the 2017 policy, and my only desire was 2.5. I don't see it happening very soon. At the rate at which we are going, I don't see it happening. We are at about 1.4, and this is both public and private put together. So as a country, your investments compared to even your neighbors, forget the developed world, even your neighbors are pretty low. With a low level of investment, if you are expecting a very high level of return, I don't think that is likely to happen. Therefore, investments will have to go up. There are signs over the last 5, 6, 7 years or 10 years where we have seen a very gradual increase in resources in health. But that's far too gradual to take us to 2.5. What health needs is not incremental increase in health spend. What health needs is a quantum jump in health spend. That is the only answer. Thank you.
Thank you, Dr. Lal. And also how the private sector, both in diagnostics and in treatment, the role played. We do know that about 70-75% of all healthcare in this country is in private hands. And that is how it has been in fighting the pandemic as well. Yet at times, there are voices that are heard which say that things were very expensive. There may be instances where that could be true also. But also, please talk about the impact that price caps that are there, and at times very unrealistic price caps that have been put by certain states as being a state subject.
So, Harsh, I'll just come back to in a minute. I see a question regarding vaccination and, a little bit of...
I'll come to that, sir. If you answer this, then we'll take up vaccination as a whole.
Okay, one second. So, I think Mr. Mishra has, said that, very, very straightforwardly. So I would just like to share some numbers with you. And there are, the organizations like the World Bank and the OECD, Organization for Economic Cooperation and Development, have pegged India's public health spend to be, in fact, much lower, 0.9 to 1% of GDP only. And of course, according to the Economic Survey of Government of India, we are saying 1.5% of GDP. So the truth lies somewhere between 1 and 1.5. And whereas, just for the record, I would like to say that America spent 16% of its GDP on health, and UK, Netherlands, New Zealand, Finland, Australia spent over 9%, and even our so-called poor neighbors like Bangladesh and Pakistan, they spend about 3% of GDP. So changing track now, the government of India has already announced that they will increase the public health spending 2.5% of GDP by 2025 in a phased manner under the National Health Policy announced in 2017. So according to calculation by experts, now here comes the number, to reach 2.5% of GDP in 2025, we need to spend an additional 1.2 lakh crores on health every year. 1.2 lakh crores extra on health every year. And since 2018, we are falling short of this target. And in this year's union budget, great emphasis was laid on investing in health and well-being. And the finance minister announced a whopping 137% increase in the allocation of health and well-being that included allocation for health, COVID vaccination, water sanitation, and nutrition. And it was found that the 3 departments responsible for providing healthcare, that is the Department of Health and Family Welfare, Department of Health Research, and Department of Ayush, were allocated only 11% more funds from the previous year. And 35,000 crores were allocated for COVID vaccination under COVID-related special provision, and this might even shoot up to 50,000 crores after what, Dr. Paul announced that we have ordered another 44 crore, vaccination doses in May. So what I'm trying to say is that, we have to do something, and the government has announced certain amount of stimulus packages with provision for health sector. But I'm sorry to say that there is no transparency on the utilization of each stimulus. For example, the first package of Atmanirbhar Bharat 1.0, 15,000 crores for health have been earmarked out of a total stimulus of 20 lakh crore for HWCs, 20 lakh crore total. And this 15,000 is minuscule for HWCs, infectious disease hospital blocks and public health labs. Then Atmanirbhar Bharat 3.0 credit guarantee support launched for healthcare sector in 26 sectors stressed due to COVID-19. And another package which has recently been announced is 23,220 crores has been allocated for public health with focus on pediatric care, ICU beds, oxygen supply, recruiting additional medical professionals. Additionally, the new 1.1 lakh loan guarantee scheme, that is 50,000 crores, will be earmarked for the healthcare sector alone. And due to this low public health spend, the out-of-pocket expenditure in India stands close to 60%, which pushes 5.5 crore of our countrymen below poverty line every year. So we must act on it now, as Mr. Mishra has also said, and harness all possible additional sources of financing healthcare. And here I would like to give another idea. It's not a new idea. So one such channel could be the channelization of CSR funds from the health sector towards priority health agendas like free diagnostic testing or essential diagnostic testing at the 1.5 lakh health and wellness centers. And since 2019, numerous representations have been sent to the Ministry of
You've been at the forefront of that, Dr. Lal.
Yeah. So anyway,
the forefront of that.
So Harsh, our job is to keep on trying, because somewhere, this thing has to dawn in that, you just cannot keep on spending peanuts, because then what you get. So that's what the point is.
Now, let me give an early data from the US about the importance of vaccination. Early data from a number of states suggests that 99.5% of COVID deaths during the first 6 months of the year have been in unvaccinated people. 99.5% of those who died from COVID-19 in the US in the first 6 months, January to June, were all unvaccinated, and only 0.5% were vaccinated people. So even though India has very ambitious targets, and some of us feel that we will be able to achieve them, how do you think, Mr. Mishra, what do you think at this point of time, when we've done about 38 crore jabs have been given, and at least 145 crore jabs need to be given in this year to be achieved that target of vaccinating the entire population, adult population of the country? What do you think needs to be done? What is happening? I do know that you have huge knowledge of the vaccination scenario in this country, since you ran it for a few years. What do you think should be done? And do you think this target will be achieved?
Absolutely, very, very critical. But before I come to that, let me just have a last word on the issue of investment and resources. First point I would like to make is that whenever we talk about increasing investment in health, everybody says public health, public funding, public funding. Please remember that we need to also increase private investment in health. I mean, if there are no investments because the returns are doubtful, we need to change the strategy. But there has to be, it can't be just government and government alone. There has to be private investment. One. Second, 1 lakh crore per year, let's say, is a very good sum. But as an administrator, I am a little wary of such a huge jump because of the inherent limitations of absorption capacity of this country. So when we talk about investment, these two have to get married. Now, coming to your question on vaccination, which is the most critical thing. You know, when the first wave was on, every corner we used to say, test, 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 test. Currently, we should only say vaccinate, 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 because that is your only protection against the third wave. Now, how have we taken it up? See, India has a very rich history of immunization and vaccination. We have had the ability through Mission Indradhanush to pick up every child who was left out of the mainstream of vaccination and get them fully vaccinated. I mean, worldwide acknowledged microplan of polio. We have all that system in place. We were among the first in the world to put even in place. My thought is that we need not always create new things to do new jobs. We can take on the existing things to improve of them to do new jobs. Now, vaccination has been slower than expected. That everybody admits. But what is the cause? One, of course, is the supply bottleneck. Second is hesitancy in some parts of the country. And third, also to an extent, is the ability to reach the arm. The shot has to reach the arm. So that gap there in terms of resources is a critical factor. Now, as far as the first thing is concerned, the supply issue, I personally feel that over the next couple of months, India should be somewhat comfortable position. Today, it is not. Newer vaccines will come. I mean, you will have newer players coming in. And I'm at this moment very excited about the vaccines from outside coming, because I don't know. A, I'm told all their order books are full, and B, I don't know how expensive they're going to be. But within the country, we have the ability, and the reason why production did not shoot up has two aspects to it. It's vaccine production is heavy investment. So you need investment from somewhere, which many countries in the world did. With that, you can actually push up the total production. And if everything goes well, over the next 2 months, our production should be high. But currently, it is low. Now, the fear is that if the third wave hits us sooner than what we think it is, we may be caught slightly napping, because not enough of the population will be vaccinated. The second cause I said was hesitancy. And I think as a country, we have, between the people, the private sector and the government, we have not been able to carry out a very focused, aggressive campaign on vaccination. With this kind of requirement of saving lives, I think we need a campaign in place. Of course, once you do a very heavy campaign, you also need to match expectations, otherwise it will become a problem. So we need the total number of vaccines. We need the people who are willing to take the vaccines. And third, we need the human resource which will reach those vaccines. But let me end by saying that if we organize ourselves better, India has the capacity to do it.
That's great to know. One quick comment. Do you think the price of the vaccine is also a factor? Because we hear of many private healthcare facilities, hospitals and others who do have the vaccine because they bought it in time, but they don't have enough takers because at 780 rupees for Covishield and 1410 rupees for Covaxin, it is quite high and is not like the 250 rupees which it was for either vaccine earlier.
See, at the end of the day, what is critical? Critical is government is giving it free.
It is.
Government is giving it free. So you have a choice of going to government and getting it free. Now, as far as the private sector is concerned, whether we like it or not, market forces will play. If it is a subsidized cost on government supplies, which is going free to the people, there has to be a cross subsidization from somewhere. Now, although it's not happening fully in India, but still. And there is certainly a population in India which can afford that.
Whether that's 25% or not,
Whatever it is,
no.
it may not be 25%, but a substantial population which can afford it. And I see no reason why, if I can afford a paid vaccine, I should queue up and add to the extra burden on a free vaccine, which is there for the person who cannot afford. I mean, but let me tell you, this is one view. There are various views on this, and this debate will continue. But as long as you struggle with these supply lines and the availability, you will have to juggle these things together so that you come to some. And I think even today, there is a tremendous amount of scope for private sector to up the ante and do more in vaccination.
Dr. Lal, your thoughts on this, and then we'll talk of the scenario once this pandemic gets over, what the country needs, how does the PMJY scheme pan out, how it should be modified. I know you have very strong views on that, but a word about vaccination first, and then we take you into the next.
So,
We have 15 minutes left.
okay. So you had just mentioned about the American example. I would just like to tell you the third wave example in UK now. That UK has now vaccinated more than 60% of its population so far, and the cases are going up, but the hospitalization and deaths have come down. To illustrate this fact, between January and July 2021, the same number of daily cases in UK are happening, which is 28,000 per day. But the hospitalization has gone down by 91%, from 34,000 to only 3,000 per day. And the daily average deaths have been reduced drastically from 98 to 98%, from 1,200 to only 25. And the opposite example I'll give you of UAE, their NCEMA, what we call the National Emergency Crisis and Disaster Management Authority, has announced exactly what you said. 92% of those admitted to ICU had not been vaccinated, while 94% of those who died had not taken the jab. So there should be no doubt in anybody's minds. I've seen this in the intelligentsia also. People say, why should we get vaccinated? There was a sportsman arguing with me, why should I take it? Anyway, so India can now offer 4 vaccines. I'm not going to go into all that. But I think why we are lagging behind also is to the fact that we actually woke up very late. We had a very slow start, and we ordered the first batch of 1.6 crore vaccines only in January 2021. Whereas the other countries, the United States, by say August 2020, had already invested 45,000 crore rupees in companies, different private companies, you have only private there, developing vaccines, and also booked at that time in August 40 crore doses. And across the Atlantic, the EU or European Union had booked 80 crore doses by November 2020. So if you are going to hit it off at 87 lakh doses per day, boy, we need to do something very, very drastic. And as Mr. Mishra said, that you bring in, film stars, you bring in, sportsmen, you bring in anybody who can help you, do this vaccination. Something like an IEC, you can call it medical propaganda, but you've got to get it right. Bring in the Rotary Club, bring in NCC, Lions Club, and whatever. And I compare it, to to the Dunkirk evacuation before the Second World War in 1939, that there were 350,000 soldiers who were trapped on this northern port of Dunkirk, and they had to be evacuated. And you know what the British did? They brought in 800 kind of boats, anything which could float. They brought them in, and they rescued 3.5 lakh people. Otherwise, they would have been dead or not available to them, or maybe in a POW camp. So according to my thinking, anybody who can hold an injection and can give a intramuscular injection should be brought in right now. And there should also be a media blitzkrieg, as I just said. So that is the way it should be taken. It should be absolutely on a war footing. And if you do not vaccinate, you're not going to get rid of this. So that it's as simple as that.
So, Dr. Lal, about your thoughts about Ayushman Bharat, the scheme started in 2018. Where are we? Has it lived up to its potential? Do we need to do some pivoting? Does something more needs to be done? 5 minutes to you, and then 5 minutes to Mr. Mishra for wrapping it all up. As a senior IAS officer, he will have the final word.
Okay, so the ABPMJ scheme is giving 5 lakh worth of cover to 10 crore vulnerable families, or 50% population, which is very good. And before that, hardly 20% of Indian population, had any kind of insurance. And of course, India lags behind in providing all this, where we have only 5 beds per 10,000 population. China has 40 beds per 10,000 population, so eight times more. And we rank a very dismal 155 out of 167 countries in this healthcare sector. So what I would like to say is that the healthcare, private healthcare in India provides 70% of outpatient treatment and 60% of inpatient. Now, 60% of inpatient treatment under ABPMJ are also delivered by private hospitals, and 55% of the 25,000 empaneled hospitals are also private. Now, getting down to the point, the private hospitals are not much enamored of the cost at which these packages have been fixed by the government. And the package rates are unsustainable and lack any consideration of cost incurred in delivering healthcare. Now, historically, 3 years back in 2018, at the behest of the government, I was the chairman of FICCI's Health Services Committee at that time. I commissioned a study on scientific costing of healthcare services. I was given only 2 months, but we could, do or go to 9 top hospitals. We want to go to 10, but we could only go to 9. And we calculated 10 procedures costing. And these private hospitals included Apollo, Fortis, Max, and 2 government hospitals like AIMS and ILBS. Now, getting costing out of, especially corporate hospitals is something which is superhuman, Herculean task. Nobody would like to share, these are very, very private kind of things, for private people, but we got them out. So what I would like to emphasize now is that for these 10 procedures, the prices which were fixed under ABPMJ failed to even cover the cost of the procedure, leave aside the cost to the patient. And a very significant discovery was that the cost of these procedures in the 2 government hospitals was similar, and in some cases even higher than the private hospitals. And currently now, of course, the Institute of Cost Accountants of India have taken up a similar costing study with the healthcare associations like FICCI, AHPI, IMA. And I must emphasize that unless we derive a rational package rate based on consideration of cost delivery of healthcare, credible private hospitals will not be able to participate.
So that probably, Dr. Lal, you're answering the question that Mr. Mishra referred to, which is that why is private investment not coming into this sector? One, of course, everyone knows this is a sector where it takes many, many years before a businessman will start getting return. The other is also that some of the government schemes, the pricing is actually lower than what it even costs to deliver, as your study showed. And I'm sure as we go forward, unless there is viability of a project, we can't expect foreign investments or even investments within the country to come. I do know that we have a lot of questions here, very specific questions that are being asked by the audience. I regret that we will not be able to answer them now, but I assure you that these questions will be taken up and will be answered by experts. We'll send you by email. Mishra ji, now your final thoughts on the future, because if not after the third wave, very soon this disease hopefully will become endemic, and then we have to look at all the non-communicable diseases. This, of course, is a communicable disease which has brought the entire world to its knees, as it has India. But we have to look ahead. Do you think that the PMJ scheme is something to build upon, provided it's made viable? The Prime Minister, when he announced the scheme, said that 1,000 more hospitals need to be built to be able to accommodate these fresh patients. Unfortunately, nothing like that has happened. I don't think even 10 have been built in the last 3 years. What are your thoughts on this?
Okay, let me begin by reacting to your statement about, not enough profit and the costs of government delivery being low as a cause for lack of investment. While I agree with you that, unless there is a justifiable return on investment in health, no new investment will come up. Nobody invests for losing. And by very definition, the private sector must make a profit on investment. And there is nothing wrong with it. But I do not agree on the point that that is the sole reason for lack of investment. No private structure should be or is planned on the basis of government schemes. They plan it on the basis of their own ability to attract patients and treat them. So investment in health should come, and it's a serious matter for everybody, particularly, all the bodies, to sit and think, why is it not lucrative in India? I mean, your own cost is not limited by anything else. But there is a problem. Is it capacity to pay? Is it capacity to invest? So somewhere that investment will have to be taken care of. PMJY was a very well thought of scheme because this was the first time that an insurance model was built around providing health protection. It was part of the entire approach of universal health coverage for all. But ever since this started, there has been this nagging discussion between the private and the sector and the National Health Authority that the costs are not regulated. The answer lies actually not in just this argument, but the answer lies in actually somebody getting down to do a costing which is acceptable to both sides. Many attempts have been made. Dr. Lal is aware that 2017, FICCI and CII both were separately asked, give us a costing. But somehow there is no common ground. And one of the very inherent things with public-private partnership in India, which is, I'm sorry to say, limited to outsourcing. There's no partnership, it's outsourcing. Is an inherent distrust which has crept in. Payments get delayed by 4 months, rates don't get checked. So there are issues. As a country, I think it is high time we thought ourselves as a supportive additionality rather than a separate way. Health delivery has to be a combined effort rather than a single effort from both sides. Now, once we have this better coordination, I think we will have a better result even in the third wave. So what do we do? First is vaccines. We've spoken about it, and we need to really go fast on vaccines, irrespective of what cost it means. Cost of life is far too great, greater a concern than mere cost of investment in health. So we need to keep investing in order to get more and more vaccines, more and more sources of vaccine. And also, supposing today we have abundance of vaccine, more and more resources to deliver the vaccine. That will have to be created very quickly over the next couple of months. The second is that we need to organize ourselves with the preparation for the third wave. In simple terms, what does it mean? In simple terms, it means that every hospital, whether public or private, must fulfill its limitation. The beds, the oxygen, the ICU beds, and the trained manpower to do that needs to be put in place, irrespective of what investment it takes. I would even advocate that if the private sector needs financial assistance out of the way to do this, we should do it. Because this, unfortunately, is a largely urban phenomenon. And in India, urban tertiary care is largely in private hands. So if there is a need to invest in the private sector and support them, I think we should come forward and do it. Now, another thing that we need to do, I personally feel, both of you are doctors, I am nobody to talk about it, but I strongly feel that we need to properly work on standardization of home care. It is the home management which will save us from any upsurge in numbers. Even during the second wave, many patients who should actually, I always say that we lost a good hospital bed to a bad patient. Because anybody who's suffering will take 14 days. So we need to work this triage, so to say, very well, that we are able to segregate who needs the hospital beds and who doesn't need the hospital bed.
Yeah, the home healthcare companies that come into their own.
Yeah, that should be encouraged. Lastly, I would also say that as a country, we need a slightly better forecasting based on science, based on epidemiologists' opinion, and based on several other factors that will help hospitals get ready in time. Now, let me come, before I end, to what the topic for the day said, demystify. I have always held this belief that the mystery that surrounds healthcare delivery baffles people across the world. Look at government. The kind of circulars we send to a block medical officer, he will never be able to read in his life or understand in his life. No, it's a fact. So what does he do? You send him that 23-page document, he keeps it. So you are not able to deliver. I think it is time when the government and the private sector should come together to bring in simplicity in health communication. Health communication has been far too complex. If you can bring simplicity in health communication, it is not just the medical facilities, but even the general people who will be able to take care of themselves. The idea is not to send everybody to the hospital. The idea is to enable the person to take care of himself. It's about wellness. So I think we need to seriously take the so-called lapses in the second wave seriously, not get caught by surprise and overwhelmed as we did, and have things in place. Now we know what we need. So have things in place well before time. And I would say, even if the third wave doesn't happen, It's only going to do good to the entire medical system strengthening if you add, let's say, 20,000 more ICU beds or 30,000 more oxygen plants. It's only adding to your system. So third wave or no wave, investment remains the key. Thank you.
Thank you very much for summing it up so very well. And, thanks to both of you, gratitude for having taken so much time out to share your thoughts. And I think the message from both of you is quite clear that much more investments are needed in the healthcare sector, and the investments not only from the government but also from the private sector. The private sector, as you said.
And Harsh, if I may just interrupt for a minute here, it's not just government and private. All external agencies, World Bank,
Yes,
you have programs being run by USAID. You have a Samrid program to support emergency care. You have other philanthropists coming. So all these will help in the long run.
absolutely. Adding to that, and also the fact that, if there is viability in healthcare delivery systems, then the investment will come. How to generate and create that viability is for the private sector and the government to sit together, dispel the mistrust or the gap in trust that does appear to be there within these two very important organs. And this is despite the fact that healthcare delivery systems in India are the cheapest anywhere in the world, and quality, which is really very good, where medical tourism is responsible for billions of dollars being brought into the country. So and also the very important point that vaccination, apart from test, we should forget the testing lesson, because that's how you will pick up. And maybe in testing genomics, which the government has upped the ante on it, to be able to pick up the mutations and the variants as quickly as possible, so that containment policies can be developed based on the testing regime. And ultimately, to learn from the previous two waves and not repeat the mistakes of the past. And in conclusion, like you very rightly said, even if we overcorrect or overplan or overinvest, fearing a third wave, it can only do good for healthcare delivery in this country, for betterment for patients in this country, because we are direly short of the number of beds, of the oxygen generators, oxygen supply, medication, trained manpower. So any and every step, irrespective of what be the reason for doing it, can only help in the long run, because this is not only about the pandemic, it is also about the neglected people of the pandemic, which are those with cancer, with hypertension, with diabetes, with heart disease, neurological illnesses, who have gone behind in priority as far as treatment went, because naturally the very sick patients of COVID became the first priority. So thank you very much, and thank you to the entire audience, who I must say have participated very, very actively in this session, much more actively than any webinar that I've had the pleasure to be on. And I assure you that we will have many more of these. And I take this opportunity also to thank Miradoc for having brought these two stalwarts together and having put together a very fine program. Thank you all very much. Good night and all the very best.
Thank you. Thank
Stay
you.
safe.
Thank you very much.
Thank you.